Peripartum Cardiomyopathy, or PPCM, is a rare heart condition. It happens during the last month of pregnancy or up to 5 months after delivery. PPCM weakens the heart muscle, making it hard for the heart to pump blood effectively. This is a serious condition that can lead to heart failure if left untreated. Symptoms can be subtle, mimicking common postpartum experiences, which makes early diagnosis crucial. The exact cause of PPCM is unknown, but several factors likely play a role. These include hormonal changes, genetics, and inflammation. Understanding PPCM is the first step towards effective prevention and treatment. Early diagnosis and proper management are essential for improving outcomes for mothers with this condition. Diagnosing PPCM promptly is crucial, but it can be challenging. Many of its symptoms overlap with normal postpartum experiences. Shortness of breath, fatigue, and swelling in the legs are common in both PPCM and a typical postpartum period. This overlap can lead to delays in diagnosis and treatment. Doctors use several tools to diagnose PPCM. An echocardiogram is the gold standard. It uses sound waves to create images of the heart, allowing doctors to assess heart function and identify abnormalities. Other tests, like electrocardiograms and blood tests, can also provide valuable information. A thorough medical history and physical exam are essential parts of the diagnostic process. While the exact causes of PPCM remain unclear, certain factors increase a woman's risk. African American women are disproportionately affected by PPCM, experiencing higher rates of the condition compared to other ethnicities. Older maternal age is another risk factor. Women over 35 have a higher chance of developing PPCM. Multi-fetal pregnancies, such as carrying twins or triplets, also increase the risk. Other risk factors include preeclampsia, a history of heart problems, and certain autoimmune diseases. Understanding these risk factors is vital for early identification and intervention. It's important to note that not all women with these risk factors will develop PPCM, but being aware of them allows for closer monitoring during and after pregnancy. Recognizing the symptoms. PPCM can be difficult to detect as its symptoms often mimic common postpartum discomforts. However, recognizing these symptoms early is crucial for timely intervention. Shortness of breath is a hallmark symptom. Women with PPCM may find it difficult to catch their breath, even with minimal exertion. Swelling in the legs, ankles, and feet is another common sign. Fatigue is a common complaint among new mothers. However, excessive and persistent tiredness that interferes with daily activities can be a red flag. Other symptoms include rapid heartbeat, chest pain, and coughing, especially when lying down. If you experience any of these symptoms during or after pregnancy, it's essential to seek immediate medical attention. Treatment options: a multifaceted approach. Treating PPCM requires a comprehensive approach that addresses both the heart condition and the individual needs of the patient. Medications are the cornerstone of PPCM treatment. Diuretics, commonly known as water pills, help to reduce fluid buildup in the body, relieving swelling and easing the workload on the heart. Beta blockers slow down the heart rate, allowing the heart to pump more efficiently. ACE inhibitors and ARBs are other medications that can improve heart function by relaxing blood vessels and reducing blood pressure. In some cases, a medication called bromocriptine, which inhibits the hormone prolactin, may be used. The choice of medication and treatment plan will depend on the severity of the condition, individual patient factors, and whether the woman is breastfeeding. Breastfeeding and anticoagulation. Navigating the postpartum period. Breastfeeding is a personal decision that should be made in consultation with a healthcare provider. Historically, breastfeeding was discouraged for women with PPCM due to concerns about its impact on the heart. However, recent research suggests that breastfeeding may be possible for some women with PPCM, particularly those with mild cases and stable heart function. The decision to breastfeed should be individualized, considering the mother's health and preferences. Anticoagulation, or blood thinning, is another important aspect of PPCM management. Women with PPCM are at an increased risk of blood clots, particularly during the postpartum period. Anticoagulants, such as heparin or warfarin, can help prevent clot formation and reduce the risk of complications. The duration of anticoagulation therapy varies depending on individual risk factors. Living with PPCM prognosis and support. The prognosis for women with PPCM varies depending on the severity of the condition and the individual's response to treatment. Many women experience significant improvement in heart function and make a full recovery. However, some women may have persistent heart muscle weakness or an increased risk of heart problems in the future. Regular follow-up appointments with a cardiologist are crucial for monitoring heart health and adjusting treatment as needed. Living with PPCM can be challenging, both physically and emotionally. Support groups and mental health services can provide invaluable support and coping mechanisms. It's essential to prioritize self-care, engage in heart-healthy habits, and communicate openly with loved ones. With proper management and support, women with PPCM can lead full and meaningful lives.